she's gone. Oh, she's here. Okay.
Yeah, I'm here.
Okay, so Mariam, one scenario I'll be doctor, and one scenario you will be doctor. That would be from the respiratory part, okay?
Yeah, sure.
And we have done two. We discussed we will be doing two scenarios today, isn't it?
Well, I thought that we'll be doing the PCP one today.
Okay,
I'll be the doctor.
okay.
Yeah,
Yeah,
I'll be the
definitely,
doctor,
definitely two scenarios. So one scenario you will do. I think I told you to do one.
No, so the TB one we did yesterday with Dr. Radwan, anyways.
You did the TB yesterday.
Yeah,
Okay.
yeah.
You
So I
done
did
TB?
the mesothelioma as a doctor, and then he did like a TB as a doctor. So we did like covered both of those
So you done the mesothelioma
as a doctor.
Okay, so PCP left. Okay,
Yeah.
so you will be doing a doc because that is very important scenario. And let's do it. Huh? Let's do it. Let's do it. So I have the algorithm for the PCP as well.
Okay.
So let's do it. So I want Zubda, you want to give me score, or anyone want to give me score? Please give me. I don't care if you give me 0 as well. Please give. Why I'm telling you to give me score? Because I want you to know how you'll be scored on data gathering part, which part you should be knowing. Because if you go through this way, then you'll get to know that total score is 12, not 16. Station is 16. The total score is 12 for data gathering, and for Ramesh, you're too good to give me for like 433. I don't like it. Myself, I'm not giving myself that much. In data gathering, I could have improved well in that one. So okay. Ramesh, you are the examiner at this time, and doctor is Mariam, and I is that dodgy guy who got PCP. Okay, and my name is Michael Brown. I'm 23-year-old. I'm homeless, and so there's a different structures in this scenario. That's why examiner love this scenario, because in this scenario you will see three different. You will be introduced by another structure as well, refusal structure, and a few other things. So well done, guys. Let me put the timer on. After that, if you just give me.
I have a question.
Who? Yes, Zubda, yes, please ask.
I missed the yesterday session, so can you please brief about the scoring?
Yes, Zubda, what we can do, so we will be assigning you one mentor as well. So the whole idea of mentor is that any one of our tutor, maybe Mariam, maybe Ramesh, or maybe any one of us, they will contact you because you are the only one who didn't get any mentor. Hasham got mentor, Saban got mentor. Yes, whoever registered with us, they got mentor. So they would have 5 to 6 sessions, but you need to tell them that what session you missed, you can take another courses as well. And they would briefly summarize that thing as well with you. Okay. So I will ask one of the mentor, I will see that who is available. They will do 5 sessions all around before your exam with you. And you can send them messages, audio messages, they will reply. And even they would summarize whatever you missed. Okay. So don't worry about that. They would summarize. And myself will summarize at the end. Okay. Is that be okay with you? I'll come with the data gathering part and everything. And yes. So after this scenario, I'll summarize. Okay.
Okay. Thank you.
Now, Ramesh is examiner, and from out of student, I want examiner as well. Okay. So let's begin now. I'm going to put on the timer, and this is the. You will hear the voice, and then after that, you will start. Begin.
Hello, good morning.
Hello, good morning.
My name is Dr. Mariam. I'm one of the junior doctors working in the GP surgery. Is this Michael?
Yeah, Michael.
All right. Can you please confirm your full name and age for me?
My name is Michael. I told you. Yeah, I just want to go home. Why don't I want to go home?
All right. Well, we can surely help you with that, but I just want to make sure that you're okay, and I need to ask a few questions. Will that be okay?
Okay.
All right. Can you please confirm your full name again and age for me?
Michael Brown, and I'm 24-year-old.
All right. Okay, Michael. So, you mentioned to me that you want to go home, right? So, could you please tell me why exactly you want to go home?
I will tell you anyway, but I just want to go home. You ask questions, but you're asking, no problem.
All right, okay. So, can you please tell me what brought you here at the GP at the first place?
I'm coughing.
Okay, I can see that you're coughing. I'm really sorry for that. Okay. All right. Are you having some struggle with breathing as well?
Oh, yeah. Coughing. I'm coughing. Okay. I'm coughing up phlegm as well.
All right. Okay. Since how long has this been happening?
hard to say, but maybe 3-4 weeks is going on.
All right. And do you mind me asking, have you been coughing any blood as well?
Not blood. I haven't seen any blood, but it's a
Okay.
white
Mm-hmm.
phlegm coming. I'm bringing white phlegm every time I'm coughing. A bit of.
Okay. And is it like, could you tell me the amount, like a cup or like a teaspoon?
Maybe a cup, a full cup.
All right. Okay. Okay. And also, have you noticed it getting worse over the period of time?
It's not getting worse, but
Mm-hmm.
it's the same. It's same. But I need you need to fix it, doctor. Help
Oh,
me that so
surely.
that I know. Yeah.
Okay, I'm here to help you, and I'll try to find a solution for you. Okay. All right.
Yeah, doctor. My sometimes I can't breathe properly.
All right. Well, we'll be looking at your oxygen levels as well, all right? To make sure that
Okay.
everything's okay. Okay.
Okay.
All right. So is there
Oxygen
anything
saturation
else?
is 92.
Okay. Well, Michael, your oxygen levels are a bit low. So how about I give you a mask with oxygen so that you'll be able to breathe okay, all right?
Oh, it's okay, no problem, doctor. I don't need any mask. I'm okay. I'm breathing fine.
Well, I can see that you say that you're okay, but it's really important for your health, okay? Would you like
But
me?
doctor, I have to go home. Let me go home.
Sure. Sure, I'll be sending you home, but I need to make sure that
Doctor, I
you're
need to get
okay.
my thing. I'm telling you, I need to get my thing. I have to go home. I need to get my thing.
Or what do you mean by the thing?
I can't
I
tell
see.
you. I can't tell you.
Okay,
I
all
can't tell
right.
you, doctor. I can't tell you.
Okay,
Let
I
me
can
go
see.
home.
I can see that you are a bit distressed. Just a few more things. I just want to make sure
I'm
that you're
telling you,
safe.
I not without that thing, and I'll be okay. I'll be fitting in front of you now. Why don't you let me go home?
Okay, I'll let you go home. All right? Okay? I'll let you go home. But I need to make sure that you're okay. That's important for your safety. I'm really sorry. I don't know, trying to be, judging or something. I just want to make sure that you're here and you're at a safe place, okay?
Uh,
All right?
what you gonna do, doctor, for me? What you gonna do? I
Okay.
told you I had to get my thing.
Okay. We'll sort something out. Okay? Just bear with me. I'll be
What
real
would
quick.
you sort out? You will give me that thing.
Well, I can ask my seniors to come and have a look at you, okay? And
Uh,
they'll help you in a better way, okay? But for now, I need to ask you a few more questions. I'm really sorry.
okay, ask question. What question you want to
All
ask?
right. Okay. So you mentioned to me that you're having this cough, and then you asked me. So I'm gonna be a bit more intrusive, right? Will that be okay?
Okay.
Mm-hmm. Do you do any recreational drugs?
Uh, it's important to tell you.
Yes, it's really important for your health, I'm afraid.
Will you tell anyone?
Well, I just want to make sure that anything is going to stay just between us and the medical team, okay? So it's going to stay confidential. You can trust me.
Okay. Yes, I do take heroin.
Okay, since how long has this been happening?
It's a quite long, doctor. I just need to get it. You just need to
Okay,
get it. I
all
need to go
right.
and take it.
All right, sure. Now you've told me, so I've got the idea where it's coming from, okay? Just a few more things, just bear with me. So you mentioned to me that you've been taking drugs for quite some time. So are you using the same, like, do you share the needles?
I don't know about that.
Okay, all right. Have you got any family history of any medical illness?
Doctor, I'm homeless. Doctor,
Okay.
I don't have any family at all. I'm a homeless.
Okay, I'm so sorry. I'm just going to quickly examine you, okay? Will that be fine? I'll be taking your observations again, and I'm going to make sure that I examine your chest. Will that be fine?
Okay.
All right.
The
Well,
bilateral Krebs saturation low, fever. Patient is scoring 3 or 4 on news.
okay, all right. Well, Michael, the thing is that you've be telling me that you've been using drugs for a really long time, and that potentially causes a person's defense system to be low. And what I'm suspecting might be causing is a serious type of an infection of your chest.
Infection.
Yeah. That would be called as pneumocystis pneumonia.
I don't want to know about that. I just need to get my thing. I have to get it now.
Well,
I have to go
well,
home.
well, I'm so sorry, but that's important that if we'll not be able to treat you now, okay,
Oh,
we might lose you. We
why
might
don't you
lose
let me go
you.
home now that I get it and I'll get it and I'll come back.
Well, the thing is that you're at this point, your saturations are a bit low as well, and we cannot let you go home. That's not
You can't. How you can't let me go home? I come myself. I go myself. So why don't you let me go home?
Well, the thing is that it will risk your life, and we don't want that.
But you can't stop me staying there.
Well, surely.
You can't stop me. Let's see who gonna stop me. I'm gonna go.
Okay, I'm gonna ask my seniors to come in and have a chat with you. Will that be comfortable?
Okay.
All right, thank you. Oh God, I never expected this kind of a thing, because I was like,
So let me tell you.
Oh,
yes,
God.
it would be this but there are few tips and tricks which if you would have followed, you have managed that. But anyway, good consultation. You tried.
Oh
but
God, no.
I want
Well, I was like, I didn't want to give up in between, so I had to make it through anyways.
You will act the same. First, let me discuss the approach. First, let's take the Ramesh. What do you say about this consultation? I want to listen from Ramesh. And Zabda, if you have anything to say, you can say that. Dr. Chima. Saban, you're not participating at all, Saban. Saban is not here. Okay, no problem. Yes, Saban is here, but you need to speak as well. What do you say about this consultation? Yes. What do you think can be improved on? And before listening to Ramesh, Mariam, you tell yourself where you were struggling.
Well, Saban has been generous by saying it was excellent, it was not. The approach, it says
you would say you would say the simulator was shit. You can say that.
But it was really hard for me. It was really hard because I was not
expecting
Radwan would
this
have
kind
been
of simulating,
refusal.
he would have been simulating very hard as well, because this scenario passing score is very low.
Yeah. And generally, I did come across this scenario in one of my mocks, I remember, but it was kind of straightforward one in which the whole history was negative, just the cough, and then the hint lied in the homeless part, and then you have to ask the sexual part of the history. So there are two types of the histories. I never knew it would come with the refusal patient as well. So as a simulator, you were excellent, obviously.
In this scenario, all three things might be that time when you got it, that was not simulated the way. I'll tell you how it would be simulated, because sometimes when you're practicing with your partner, sometimes you have to know that you're practicing right. In this scenario, it is what? Refusal structure, drugs history, sexual history. Quite loads of things to do in this scenario. It's not a doable straight away scenario. True. Now I'll ask Ramesh, what do you think how it could have done better?
Well, you were quite hard on the doctor.
I was
and
not. Because doctor didn't ask the question. Doctor is not giving me the thing. If doctor would have said, I will give you something which is different to that methadone, I would have calmed down. But my doctor didn't mention. I wasn't
sure that am I supposed to give or not. So
I'll speak to that. I'll speak of Musairat, I will do this scenario. I'll tell you little tricks. Confidentiality, bring confidentiality in the start. You had to do that. At some point, I noticed that you got irritated of me and you got offended. The thing is, if you got offended, the paid actor has been paid. So, in any scenario in your real life as well, you will see very tough patients, you will see very tough simulators. That is made that way. The whole idea is that you don't get offended, you get oversweet. In LGBT scenarios, the people will get angry, you get oversweet. I'll try to be oversweet if you do it. I want you to be very strict like I was, but I'll tell you few codes, because GMC or examiner want to tell you that how you would convince anyone, like someone. If someone is on the drugs abuse, they need drugs, they're not going to listen to you. I've seen loads of patients when they would say, I'm going to be fitting in front of you, if not, you're not going to give me this. Then we as a doctor, I have done this simulation quite many times in different academies. Trust me.
I remember teaching us this as well, and you told us that you have to go through the carrot and stick approach.
Yeah, that was a definitely it's a refusal thing. I'll come to that as well. I'll try to cover everything. Okay. So Ramesh, basically, I will come to that. Mariam, you tried well, but the thing is, the structure itself contains few things which need to be followed. So now, Ramesh, you want to add anything? What you think that could have?
Well, Dr. Mariam was doing really good. She was trying really hard to bring you to the point to stay in the hospital and get the treatment. But obviously, she had to give something alternative to the heroin.
Yeah, she didn't give me. She didn't talk about methadone or something antidote for that.
So like if we see a patient who is very keen on smoking and he says that I want to smoke in the hospital, so we find some smoking area for the patient so that he might stay in the hospital. So this scenario also goes this way, like if the patient is very much willing to take heroin, so and we want him to get the treatment, so we offer him something that he might stay in the hospital and get the required treatment, and
Withdrawal
then we can.
symptoms. So if he's getting withdrawal symptoms, we need to give them something different. We'll give you something different for your drug cessation or something like that. Okay. So that's fine. Let's quickly discuss approach. I'm going to share my screen and then I'll tell you what approach need to be followed. Okay. So let's quickly share my screen now. So basically in this scenario, why we have done it, this scenario again. So basically it's a type of atypical chest infection. So how we would be doing it. So yesterday, I think you have done this sketch. Yes. So let's quickly go through this. What are the point in these scenarios? How will you take the cough history? So always remember, if somebody is coming with cough, do the triad, shortness of breath, or problem breathing. Don't say shortness of breath and ask him that. So somebody saying, okay, you mentioned that you're having cough. Can you please tell me more about that? Is that productive or dry cough or any blood coming out of that? Or you said it's a phlegm, then ask about color, consistency, how long you're having, suddenly or gradually, moves elsewhere, change over time, anything make it worse or better. And you will give options about that. Triad, chest pain, problem with the breathing, and cough already. Fever, weight loss, lumps and bumps, sweating. You can ask about that. You can ask about chills. You can ask about night sweats. You can ask about vomiting or few of the whatever you could be able to do that. But first of all, if somebody is going to say, I don't want to stay in the hospital, you need to resolve that issue. If you don't resolve that issue, that patient won't let you finish till end. Okay. So general background wise, you need to ask about signposting, think about general health non-allergies, medical history, family history, where do he live. So you can ask about where he live, he's homeless, okay, and he's doing drugs. So when you would say that, so the problem is that, Mariam, so you had to explore that why he want to go home, what he need, tell them, you can share with me. So you would have offered confidentiality in the start, then he would have told you that I need my drugs. And that you would say, definitely, will you, when I said, will you give me that? Then you would say, definitely, when you will say, we will be able to give you something different, similar to that, but something different. Okay. Similar to that, when you're talking about antidote or something. After that, you will say, have you given a thought? What's going on? You skip the eyes because there was quite a lot of things going on. That's why you couldn't. So I will quickly look, listen, and feel your chest, and I'll send infection marker. I'll do chest X-ray. I told the patient is using 4. That means that patient need to go stay here. But definitely, patient has capacity. You can't keep him in the hospital. You can't say we can't let you go. So how you can let me? So that sometimes they get angry, but sometimes you need to explain that. Explain the findings, give diagnosis, chest infection, a typical chest infection, explain finding first, double check patient understand, then come to characteristic approach in which you will say, okay, we need to keep you in the hospital. Why? Because we have to give you antibiotic because your chest, your X-ray shows your breathing is not good, or we need to keep you according to the CUP scores. News is for not patient is not stable. When you tell them we need to there shouldn't be camera test or something like that. It's only I will remove it. So X-ray will do it. We might give you IV fluids, antibiotic through your veins, resolve drug cessation issue, offer services like methadone. Is that methadone is antidote of heroin or cocaine?
I'll have to recheck.
Sorry?
I'll have to recheck.
Yes,
I'm
please
just
recheck it. Maybe I just out of my mind. That was I think heroin or methadone. So anyone write in the chat box. It's not in my head.
Yeah, so it's for heroin. Yeah,
that's fine. So I would just wanted to double check that I'm telling you right thing or wrong. GP to social services, accommodation service. I told you I'm homeless. You didn't. You have to. Okay, let's try it one more time. Let's try one more time. Who want to be simulated? Ramesh or Mariam? Mariam, Mariam. This is your time. You can pull your. You can now. You have a chance that you make me tough. You give me tough time the same way. Now, but I will tell you guys. You have to score me how, and how to simulate with Mariam. If I offer you confidentiality, then you will tell me about your drugs. Okay.
Okay. Yeah.
If I don't offer you confidentiality, you will. One more thing I want to tell you guys. Where I am. I'm here. One more thing I want to tell you guys. Refusal structure. So in refusal structure, basically, you need to explore the reason, then you need to tell the benefits of giving treatment, and then side effects of not giving treatment, and assessing capacity. So you need to check the capacity. So I remember when last time Dr. Abdullah, Dr. Faizan explained about how to assess capacity. So I will try to give everything what I could. I'll try my best. So, but still, you can score me 3, 2, 4, 5. I don't care. But I want to try here. Okay. So I'm going to put the timer on for myself. And the patient name is what's the patient name is? Michael?
Brown.
Sorry?
Michael Brown.
Michael
Yeah.
Brown, okay. And you are homeless.
Mhm.
You want to go home because you need to take your drugs.
Mhm.
And if I'm not good, I'm not polite, if I don't offer you anything similar to drugs, you
He's
don't.
homeless, then why is he going to go home?
Yeah, I remember when I was simulating this scenario, one of my the student, he literally said that you want to go home, but you said you are homeless. I said I mean my friend's home.
All right. Okay.
Because the homeless usually sleep around anywhere,
Yeah.
something like that.
Yeah, sure.
So let me put the timer on. Okay, just let me get the timer. Okay. Enter the room. Hello. I'm Dr.
Hey.
Gafar.
Mhm.
It's Michael Brown.
Yeah, that's me.
Hi, Michael Brown. I'm one of the doctor here in A&E. I want to help you today. Could you please confirm your date of birth for me?
Yeah, so it's 17th August, 1998, something, yeah. Yeah.
Thank you very much. And nice meeting you. Welcome.
Mhm.
And I'm all here to help you. Can you please tell me what seems to be the problem today?
So I've got this cough, just fix it.
Cough. You're having cough. Okay.
Yeah.
Can you please tell me more about this cough?
Yeah. I'll just fix them and let me go home.
Yeah, definitely. I need to ask you more questions. Definitely, nobody wants to stay in the hospital. But I'll quickly ask you questions, quick examination, and make sure that you're safe to send home. Is that be okay with you?
Yeah, just ask questions, yeah.
Yes. Okay. Quickly.
Mhm.
Can you tell me more about the cough? Are you bringing up anything out of it?
Yes, it's got it's not dry, it's got phlegm, sputum. Yeah, so it's white in color. It's coming there since it started. And it's getting worse.
Oh, I'm sorry to hear. You look little out of breath as well. Definitely, I'll make sure I'll provide you help. And you mentioned that it's a white phlegm. By any chance, have you noticed any blood in that?
No.
And how much it comes up when it's come up like amount wise?
What do you mean?
Like a amount, like a cup of tea, or how much it is when you cup up?
No, like a teaspoon maybe?
Okay, teaspoon. Right. Apart from that, have you noticed you're running any temperatures?
No, I'm not noticing anything. Just fixing it. I want to go home.
Oh, you're very keen to go home. Definitely, I would.
Yeah.
Tell me the reason why you want to go home.
I've got some things to do. That's it.
You have some things to do. Okay.
Yeah, they're important.
I might help you with some things you can share.
No, I'll do it myself. Yeah, I need to be back home.
Definitely, but I would like to tell you, if you want to share anything with me, you are at a very safe place. I'm a doctor, health professional, and I'm going to help you with anything, and it would be confidential between you and me and our team.
Hey, I need to take a shot of heroin.
Oh, all right. So you're using heroin. Okay.
Yeah.
So definitely, I'll come to
So I
that.
need to go and just fix it, and then I just need to go.
Oh, definitely, you mentioned that makes sense that you're taking heroin and you need it.
Yeah.
If I tell you that I might help you with that, might be giving you some substitute for that, the similar to heroin that would help you.
So you're telling me that you'll be giving me heroin in the hospital?
Oh, no, not specifically heroin, the treatment for the heroin.
I don't want any treatment. I just want my heroin.
Yeah, definitely. Can I quickly ask questions regarding your cough problem? Then I'll come back.
Yeah, just fix that. Yeah.
Okay. You mentioned that you haven't noticed any fever, any lumps and bumps in your body.
No, I'm not noticed.
Okay. Any problem with the light and foot?
No.
Light hurting you? Okay. Any pain in your neck at all?
No.
No. By any chance you vomiting as well?
No.
Any pain in your tummy?
No, it's just the cough, doctor.
Only
Come
cough.
on. Yeah.
And chest, I'm sorry, any chest pain along with that?
When I cough a lot, then I get some.
Oh,
Yeah.
okay. How the pain is like? It's a sharp pain or something?
No, just when I cough really hard, then it's
Okay,
pain.
only during the cough.
Yeah.
Okay.
Yeah.
Well, thinking about your general health, are you fit and well generally in medical condition?
I don't know.
Okay. You don't, it's okay, no problem. Any allergies do you have?
No, when's the question's gonna end? I need to go home.
Definitely, just few more questions, and definitely I'll tell you what I can help you with the hearing. I do understand you
You're
need.
gonna help me with the heroin?
We can offer you something similar to that. We call methadone. That will help you with the symptoms you're going through at the moment. Will
Okay.
you, I can arrange that for you. Is that okay with you?
Yeah, I just want to get fixed.
After
Yeah.
my question, I can ask my nurse that will bring that and will keep you here.
Okay. Just ask questions.
Okay. So at this point, I would like to ask, what do you do for a living?
Well, I'm homeless. So nothing.
Or definitely you might need some temporary accommodation as well. I'll try to sort this out. So Michael, you mentioned that's been going some long time. Have you given a thought what could be the cause?
No. Just fix me, don't. It's driving me crazy. Come on.
I do agree. I'm sorry. It must be affecting you as well. Definitely, you're coughing a lot. At this point, I would like to take your observations.
Yeah.
And your oxygen saturation. I'll quickly listen to your chest. And after that, any finding?
88.
Okay. So, Michael, at this point, after having a chat with you after my assessment, I'm thinking you're having a chest infection, and which is not a typical one. It seemed like something different compared to the normal chest infection called
Well, I
PCP.
don't care what that is. Just fix
You're
me,
very
and
precious
then
to us, Michael.
I need to get.
You're very precious to us. We make sure we treat you well. Okay. So we call it
Yeah.
PCP. For now, we need to keep you in the hospital. I'm sorry for that. Is that
Well,
okay?
I can't stay in the hospital for obvious
But if we arrange a
reasons.
methadone
I
for you,
can't.
you'll be able to. If we get a similar thing for you, you'll be able to do that.
So it's similar to heroin, yeah?
Yes, similar to that. But it will help the treat the symptoms.
But what if it doesn't work? So will you be arranging heroin for me?
I can't do that because drugs are not allowed. But at the moment, we need to give you antibiotics through your lines. Make sure you're okay. We'll give you some IV fluids and we'll keep you for a while. That will get better. Okay with you. In the meantime, we'll start you in the treatment for that the heroin sedation.
Why did I get the chest pain, the chest infection? Why did I get this?
You might have got through because I had to ask you a question about your drug history because you might be injecting that through needle, isn't it?
Yeah.
So there is high likely that you might have got this infection because your immunity is gone down, and we need to run a few more tests to check your immunity level. Some problems related to the infections like hepatitis B.
Welcome to the next station.
I couldn't done it myself. That was it's a hard patient anyway. Well, yes. So Mariam, debrief it.
All right. So I was being really a jerk, to be honest. But yeah. So you did really well. You really calmed down. You knew what you want to do. So that was a good thing. And then you were not in any kind of way that you were judging. So that was a good thing. Obviously, when you're in a situation which there's a lot of the way you want to negotiate with the patient, you tend to lose what you are going through in a track to ask a few questions. Like in breathing difficulty could have been asked really earlier, and then the saturation levels because she was struggling anyways. And yeah, sexual history was important as well, and the drug history. When one mentions drug, these two could have been there as well because the idea, homeless, drug users, just go with the flow with the sexual history and might just omit the other part. And a few questions, I think light sensitivity, I don't think so that were important in terms of the cough. But yeah, so all in all, you kind of agreed me to stay in the hospital, and then so that was the main thing, and also admission and antibiotics. So it was a good one. I think a 9 or a 8 maybe. But yeah.
All right. Thank you very much, Ramesh.
No
So I'll
worries.
try to improve this next time. So Ramesh, do you have any point to say? Is refusal case or just a PCP? It contains refusal. It contains a refusal, part of refusal where you say, I want to go to home. So refusing admission. But if you provide him methadone, he would be say, okay, thank you, doctor. And yes, it usually happens. So somebody is coming to hospital with the alcohol withdrawal symptoms, they start shaking, and we give them any chlorodiazepam oxide, probably next they say, okay, thank you. So this is how it goes. Anyway, Ramesh, you want to say anything about that? Or Adam? So we'll have to
No.
cover quite a lot of
Good.
other things. Sorry?
You did everything right, and the part where you offered temporary accommodation, that was a good point as well for the homeless person.
So
I
was
thought
trying
you
to
would
do,
miss
the
it, but
thing
you
is,
did it.
the point which is, if sometime patient says that I want to go home, I'll so add some ideas, say that you are very precious to us as a team or something. Try to use we, us. Don't say trust me, because I remember I was giving mock to one of the doctor in my PLAB time. I said, trust me. He said, you're talking like you're talking to your girlfriend or wife. Trust me. It's like it's like more something like that. So yeah, so try to be more using we rather than I, and try to build rapport with the patient, and try to be sweet when the patient get angry. So try to be very sweet. Thank you. So we'll move to the next from the Ramesh. So what was the second scenario you was doing? I have to do that, or you have to?
You had to do that one, and
Oh,
it was
okay. Tell me
atypical.
a story. Tell me. Let's try it. Tell me a story.
It's for atypical pneumonia. So
This is done.
yes,
So let's
that
do the. We have done it. So we'll do another one from any other symptom.
you can do
Let's
any.
do. Yeah, yeah. Do any scenario from